So stem cells, a lot of people have been talking about stem cell treatments. There's a lot of buzz in the media or on the news. So let's talk a little bit about the stem cells. What are they? So stem cells are a cell in your body that hasn't determined what it's going to be yet. So we have all kinds of cells, whether it's a muscle cell or cartilage cell, bone cell, hair cell. So lots of different cells in our body make up who we are, but a stem cell hasn't really determined what that is yet. So at, for a stem cell procedure, what we're able to do is we're able to obtain stem cells from your body, and we're able to isolate them, and we can take those stem cells and put them with precise image guidance into that area that's been damaged. So let's take an example. So for instance, knee arthritis. Most people that have knee pain that come in to see me have had arthritis diagnosed. They've had a lot of cartilage loss. They've gone to see another doctor that told them that they either need to start with a cortisone shot or they need to have a replacement surgery. They're bone on bone. This might ring a bell. Or even shoulders. I've heard of people having rotator cuff tears, pretty significant ones. They're told that, they're likely going to need a surgery in the near future, and it has a lot of downtime. So how do stem cells help in that process? So when you have a lot more tissue loss, stem cells are very potent in terms of healing because of this ability not only to turn into a different cell, like a rotator cuff tendon or cartilage, but they're also able to regulate other cells around them and a healing process. So at Rejuv, we're able to take these stem cells and in a very simple procedure, and we're able to precisely image guide them right into that spot. And over a period of time, your body knows what to do with that and can heal it up, and you don't need surgery. Stem cells are a very important part of what we do here and can be a very excellent treatment for your existing problem, whether it's your knee or your shoulder or your back or your ankle. There's many areas that we're able to use it. And a lot of people want to know, is this something that's been well studied? Yes, there are more and more studies coming out there that have been very positive, showing it can turn into cartilage and have regrowth. We've shown that it is improving people's pain, and we've seen that it's improving their mobility and over years, and it's sparing them from surgery. And the other question I get is it safe? And yes, we've seen studies from, so for the bone marrow, we've seen the studies show that it's safe. You're not going to have cells that start turning into cancer and causing, those kind of things in your body. So you don't have to worry about that. So it's a very safe treatment. And so, I highly recommend it. And I think that if you have pain, give us a call, or let's come in and talk about it more if you have more questions.